So today we're going to talk about treating low backs, something we treat a lot in the clinic, and you probably use your laser a lot on it. There's lots of little flavors for low back pain, whether it's arthritis, a nerve problem, a neuritis, muscle guarding, inflammation of an SI joint. All these things will have an impact on how you set the laser up, where you're going to treat. Today we're going to state that our patient has a problem in the L2 area and has some muscle guarding in the erector group. That's on the ipsilateral side. You'd want to factor in, the area that you want to treat first. So you have to take into consideration, as we know with the spine, that there's innervation a couple segments above and below. So if you had an L2 pain or a facet issue, make sure that you're covering the muscles and the nerves that are at least a couple segments above and below. So in this case, if L2 were here, we'd want to make sure that we're incorporating up through T12 and then all the way down into the L5 area. Just due to the reciprocal nature of the nervous system, always a good idea to treat both sides of the back. Whenever you're treating, a unilateral issue, you're just going to get better results that way. So palpating and getting a sense of which muscles are guarding is always important. The laser does a great job of quieting down muscle spasm based on how it works. So if you had a lot of quadratus lumborum involved or a lot of glute involvement, you want to make sure that you include those areas into your treatment. For today's example, we're just going to state that she has erector spinae tightness and guarding with an L2 problem. So for an area estimation, a claw grip is roughly 100 centimeters squared. You're going to estimate out how much area you'd have to treat. So in this case, it would be 100, 200, and since I'm going to treat bilaterally, 300 and 400 centimeters squared. For most low backs, if you're trying to treat between L2 and L5, that's going to be a pretty good estimation on the area. So if you're using our equipment, with the perfect protocol, you'd go to your operations screen, hit the perfect protocol button, and in this case, we're going to put in 400 centimeters squared for area. As far as power, usually when treating the back, you're dealing with a deeper structure, so you're probably going to want to use the max power you have available to you. We're pretty close to it. The only exception might be if you had a radiculopathy going on, which we'll talk about in a second. In this case, she had no radicular complaints, so we're going to use our full 15 watts. And dose, you want to be between 10 and 15 joules per centimeter squared. In this case, since we're trying to reach a facet, and again, she doesn't have any radicular complaints, we would go to the full 15 joules per centimeter squared. Skin tone, she's medium complected. We're going to leave that be on the default and hit calculate. So for this treatment at 15 watts, we're going to deliver 6,000 joules of energy. It's going to take 6 minutes and 40 seconds to do so. Strongly recommend whenever treating the spine, hip, or areas of deeper tissue you're trying to address, use the large massage ball. The compression and the ability to focus light is optimized when you use this attachment head, and you'll get your best results with it. Treatment's pretty straightforward once you get the machine set up. Once the spot comes onto your hand, you know that it's ready to go. And you're basically going to just try to paint that tissue in a crosshatch fashion, moving 1 to 3 centimeters per second. No problems to cross over the spine. And again, you're just visualizing the erector spinae. In this case, since we think she has a right-sided L2 problem, if you wanted to spend a little more time over that L2 segment, that's not a bad idea. But you just want to respect the whole area that you've estimated for the treatment. And since we've done that all the way from roughly L1 to L5, you want to make sure you're treating over that entire area, not just over the L2 segment. If you, by chance, intended to just treat over the facet, obviously the area for that would be much smaller. If this was 100 centimeters squared and I was just going to treat over L2, your area might be, 30 to 40 centimeters squared, and the treatment over that facet would be much smaller. But as we know with low backs, usually there's multiple tissues involved with muscle guarding from different areas. So if you're trying to get the best outcome for your treatment, just incorporate all those tissues in your treatment if you can. I mentioned earlier that if you have a radiculopathy involved, that you might want to use slightly lower power. And the reason for that is that nerve tissue has the ability to absorb a lot of light. It's very mitochondrial rich. So that if you put too much energy into it, you can really get a spark and subjective pain 2 to 3 hours after the treatment. So you want to just go a little more conservatively out of the gate on those folks. If they're talking about pain that's coming down into the hip or lower leg, use a more conservative dose, recommending 10 joules per centimeter squared to start. In power, you might want to be in the 10 to 15 watt range to start. After you get the feedback from them on the next treatment, you can then adjust accordingly. If they said, hey, I was pretty sore after that last treatment, you might just leave it where you had it, or you might bring it down a little bit. If they said, hey, I've been feeling a lot better, no problems, and you're noticing an improvement in symptoms, then you probably would want to move towards higher power settings, 15 watts if you had an FXI, and up to 25 watts if you have one of our EXPI units or newer 25 watt units. And then if you're lucky enough to have one of our 40 watt units, using your higher power is really going to help make an impact on that pain very quickly. So going towards your 40 watts of power would be recommended, as long as they don't have that radicular complaint. Once those are coming down, even if they did have that sort of scenario and they said, hey, I'm not having as much pain in my leg anymore, that would be an indication that you could start to increase power a little bit to get more pain blocking impact from the laser. But that should sort of be how you navigate that based on the subjective feedback you get from your patient. So let's review. Treating low backs, you want to make sure you try to treat bilaterally if possible. Involve all the soft tissues that you think are involved. Power is going to range anywhere from 10 watts all the way up through 40 watts if you have that capability. Starting more conservatively maybe on that first treatment, and then being more aggressive as you get feedback and know that you didn't cause any flare-ups from the initial dose that you chose. Dosing, if you had an acute problem, radicular problem, you might want to start around 10 joules per centimeter squared. And then for more chronic problems, or as you get into your treatments, working towards 15 joules per centimeter squared is recommended for a dose, since you are addressing deeper tissues. Hopefully that helps, and good luck.